Hey farmies, I'd like to talk to you about amiodarone. So let me give you this little card. Amiodarone is an antidysrhythmic medication. It is given for AFib, VFib, and ventricular tachycardia. So anytime we have too much chaotic electricity happening in the top part of the heart, trying to make it down to the bottom of the heart. Up here, this is AFib. If it starts happening, if these messages are all getting through, all of those crazy messages are getting through, then we would have VFib or VTAC. So this is what we want. We want the message to start here at the sinoatrial node, have an organized contraction of the atria, the message to go down here, an organized contraction of the ventricles. So when that's not happening, when we're getting lots of little messages, we call that AFib. Atrial fibrillation, instead of having one contraction, every single one of these sites is saying contract, 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 and we're getting all kinds of a little quiver. It's just a little quivery motion of the heart. So what this medication does is it blocks the potassium channels. So by blocking the potassium channels, it changes this action potential again that we talked about in another video. So it prolongs the duration of the action potential. It slows this down because it's going really fast and quivery. If you look at this heart, this little rhythm right here, there's nothing organized about it. There's no nice pattern like we see in the normal heartbeat. It's very disorganized, very chaotic, and we want to slow that down, kind of reset everything so we get a more organized, more efficient heartbeat. So a couple of problems with this. Because it's a potassium channel blocker, we need to make sure that our patient's potassium levels are good. So we have to make sure that if they are low on potassium, we replace it. We need to have you need to check their labs and make sure that their potassium labs are in normal range before you give this amiodarone. Makes sense, right? Potassium blocker, check potassium. And then because of the way that this is processed, we can get an increase in our DIG levels by up to 70%. That's huge. Exclamation point, exclamation point, exclamation point. If your patient is taking digoxin, your physician needs to know about it. We need to either stop that med or lower the doses, hold the med while we're giving amiodarone because we can get dig toxicity very quickly while we're giving amiodarone. Okay, there you have it, amiodarone. Have a great day.